Hello, Miss Booth. I'm Dr. Coleman. Have you got a sticker for me?
Yes.
You've had a chance to read the scenario
Yes.
outside? Okay, so this is a practical procedure of an arterial blood gas. Before we start, can I just ask you what equipment you'd get together to perform this procedure?
For an arterial blood gas, I'll need an ABG syringe with a blue or orange needle. I'm going to need a cleaning prep to clean the site, some gauze to put on afterward, and I'll also need gloves and an apron and a sharps box.
Okay. And what arterial sites do we normally obtain the sample from?
So an arterial blood gas would normally be taken from the radial artery, although if that's not available, you can take it from the femoral artery. And I think I've also heard of the brachial artery being used, but not very often.
Okay. And I've luckily prepared the equipment in advance, so there we are. There's a tray of equipment. So I'd now like you to perform the procedure for me, please.
So first of all, I'll introduce myself to Mrs. Smith and ask for her consent.
Okay, yes, you can assume that consent has been given.
I also need to wash my hands.
Yeah.
Make sure I've got all of my equipment there. So I'm just going to move this over to Mrs. Smith. I need to put on some gloves. Do I need to put on an apron?
No, don't worry about an apron, but see whether you can get those
Never
on.
going to be able to get these on with the hand gel.
That's fine. Take your time. You've got plenty of time to do the procedure. You shouldn't be rushed for time.
Okay. So I'm getting my gauze ready so that once I've finished the procedure I'll be able to put it on straight away.
Okay.
Taking out the arterial blood gas syringe. Need to empty out any heparin that's left in there and keep the cap for later. Just taking out a needle to pop on the end of that. And I just need to clean this out. So now I'm going to warn Mrs. Smith what I'm about to do.
Okay.
Taking the cap off my needle. Just feeling for the pulse. Going to draw back about 2 or 3 mils.
Okay.
I'm going to press down, and then I'm probably going to ask Mrs. Smith if she's able to press down for me, or somebody else if they're present.
All right, well, we'll ask Mrs. Smith to do that. So just assume she's pressing on there.
This needs to go in the sharps box. I need to roll my sample to prevent clotting and remove any excess air before I cap it.
Okay.
Then, if I have a name label, I'm ready to go to the machine.
Okay, what other information will you require when you go to the machine?
So I'll need Mrs. Smith's name, her date of birth, and her patient identification number. And if she's on any inspired oxygen, I'll also need to record that.
Okay. And from an arterial blood gas machine, what parameters do you get? What information do you get back?
The arterial blood gas machine should tell me Mrs. Smith's arterial oxygen concentration, carbon dioxide concentration, and some values about her acid-base status.
And what sort of values about acid-base do we get?
So tell me the bicarbonate, the pH, and the base excess.
Okay.
And then some machines also give us sodium and potassium level.
Okay. And lastly, obviously you've got a particular scenario here, a person that's in the emergency department, but are there any other circumstances in which an arterial blood gas may be performed, may be helpful?
So I think you do an arterial blood gas in any patient that was breathless, any patient that was unconscious or in arrest. Sometimes they're used to record carbon dioxide in patients with COPD, and you also use them if there's any kind of acid-base disturbance, such as in diabetic ketoacidosis.
Okay, I think our time's up. Thank you very much.
Thank you.